Welcome to this explainer. Today, we're breaking down a genuinely fascinating recent webinar from the creative reconstructive aesthetic surgeons. We're going to see exactly how advanced microsurgery is literally changing lives. We're talking about everything from microscopic joint reconstructions all the way to massive global training initiatives. It is a brilliant, behind-the-scenes look at the absolute cutting edge of medicine.
So let's dive right in by asking the core question facing the patients at the center of this medical breakthrough. What actually happens when you lose a vital joint to a severe tumor? Or, in a completely different scenario, what happens when you suffer from chronic, debilitating swelling after a life-saving cancer treatment? Honestly, these are catastrophic, life-altering conditions, but the medical community is engineering some truly miraculous solutions to overcome them.
First up, we're looking at rebuilding the human thumb, specifically focusing on Dr. Rahul Patil's microsurgical approach.
Dr. Patil operates out of a highly specialized tertiary hand surgery center in Oman, and he sees some incredibly complex cases. To save the hands of patients who have lost their vital thumb joint, specifically the CMC joint, to aggressive things like giant cell tumors or chondrosarcoma, he uses a technique called a vascularized metatarsophalangeal joint transfer. Now, in plain English, they take a living joint from the patient's second toe, complete with its intact blood vessels, and transfer it to the hand to become a brand new thumb joint.
Now, you might be wondering, why don't surgeons just use a standard bone graft? Well, the difference in the outcome is huge. A simple bone graft, like taking bone from the hip, is totally fine for smaller defects. But if you've lost the whole joint, it results in a fused thumb, zero mobility. You can't pinch, you can't grasp. But the vascularized joint transfer from the toe, that maintains living tissue and, incredibly, restores the vital mobility of the thumb. It quite literally gives the patient their hand back.
The crucial point here is how this meticulous 5 to 6 hour procedure is actually staged out. It takes a dedicated team of 5 microsurgeons working in perfect tandem. First, they completely excise the tumor and the damaged tissue. Next, they fix the new toe joint into place. But here is the absolute genius part. They fix it in slight hyperextension. Why? Because toes naturally have limited flexion but really great extension. So by angling it just right, they maximize the thumb's new bending range. Then, they stabilize the whole thing with K-wires and provide soft tissue coverage with skin paddles.
And the results are nothing short of incredible. Looking at the data from 3 to 5 year follow-ups, patients are demonstrating excellent functional outcomes. They've got good range of motion and opposition, meaning they can actually touch their thumb to their other fingers. And perhaps most importantly, in these tracked cases, there have been 0 tumor recurrences so far. It is a complete restoration of function.
All right, moving on to our second section, aesthetic lymphatic surgery and expanding to whole body recovery. Shifting gears a bit from bone tumors to severe lymphedema. This is a painful, debilitating swelling often caused when cancer treatments damage the lymphatic system. Professor Isao Koshima's remarkable work shows a massive evolution in how we treat this. Back in the 1990s, the focus was purely on the physiological plumbing, just trying to reconstruct the lymphatic pathways. But over the past decade, there was a major transition to volume reduction. And today, he's performing comprehensive aesthetic contouring combined with that physiological reconstruction. He's not just reducing the swelling, he's actively restoring the patient's natural body shape, right down to whole body contouring and facial aesthetics.
Just to put this into perspective, over the past decade alone, Professor Koshima has meticulously refined these aesthetic lymphatic procedures across an impressive 147 clinical cases. And that work translates to a staggering 90% success rate. He achieves this primarily by utilizing a combination of liposuction along with lymphatic channel transfers, mostly in female patients with an average age of about 54.
But what's truly astounding, and what makes this a real medical breakthrough, is the longevity of the results. His data includes maximum follow-ups extending up to 22 years. So this isn't some temporary fix where the swelling just comes right back a month later. He's proving the permanent, life-changing impact of combining this aesthetic and physiological surgery.
Let's look at some specific patient data, because this shows exactly how these procedures lead to dramatic, measurable reductions in swelling. Take a 61-year-old female patient with severe left-side lymphedema following cervical cancer. After the lymphatic channel transfer and liposuction, she saw a massive 30% decrease in impedance measurements and a dramatic improvement in her lower leg. Or consider a 32-year-old female with a rare GATA2 gene anomaly that causes lymphatic abnormalities. Through a series of highly targeted surgeries done purely under local anesthesia, they achieved partial but highly significant improvement.
The absolute crucial takeaway here is perfectly summarized by Professor Koshima's own philosophy. This isn't just about aesthetics for vanity's sake, not at all. It's about giving patients their livelihoods back. When patients are finally freed from the constant daily burden of heavy compression therapy, their overall quality of life skyrockets, and crucially, their economic prospects improve because they can comfortably get back into the workforce.
Which brings us to our third and final section, training surgeons in Africa and scaling the microsurgery miracle.
Zooming out to the global map for a second, keeping these life-changing skills locked up in a few tertiary centers in Oman and Japan simply isn't enough. The medical group we're discussing has a highly actionable plan to scale these microsurgery miracles, specifically focusing heavily on training surgeons in Africa. And they aren't just talking about it, they're on the ground doing it. Dr. Z.R.A.Z.Y is actively organizing specialized training workshops right now in Egypt. They're directly partnering with local medical leaders, specifically reaching out to Dr. Tariq Amrat, Cairo University, to really anchor the efforts. And to make absolutely sure the training is world-class, they're establishing a rotational guidance system. This means expert international microsurgeons, including Dr. Patil and others, will literally rotate through Egypt to provide hands-on support, bringing these advanced lymphedema surgical skills directly to African surgeons.
By arranging for these expert microsurgeons to provide continuous rotational support in Egypt, they're building something genuinely sustainable. The ultimate goal isn't just to fly in, do a few surgeries, and pack up and leave. It's about empowering local medical teams in developing nations to perform these incredibly complex reconstructive and lymphedema surgeries completely independently. They are building a self-sustaining network of surgical capacity across the entire African continent.
To wrap up our explainer today, I want to leave you with a provocative thought on global health equity. We've just seen how a toe can replace a thumb, and how decades of severe, painful swelling can be permanently reversed. But as these microsurgical techniques become even more advanced, how quickly can we share these life-changing miracles with the rest of the world? Because at the end of the day, a medical innovation is truly only as powerful as our ability to share it with everyone who needs it. Thanks so much for joining me on this deep dive, and as always, keep asking the big questions.